Hello. In this presentation, I will discuss the application of laser Doppler holography in the anterior segment for the purpose of blood flow imaging, eye tracking, and the transparency assessments of the corneal and lens. Laser Doppler holography is a technique that we have previously applied mostly to image retinal blood flow with a high temporal resolution. This can be useful, for example, to measure the resistivity index. So on this picture there was an occluded vein and the vascular resistance was increased in the corresponding artery, which we could reveal with LDH. And we also found that LDH is quite performant to image the choroid. So it allows revealing all the choroidal vessels, arteries and veins, and even to distinguish them. So here we have tried to evaluate what could be the possible uses of LDH in the anterior segment, and the first that we found, of course, was blood flow imaging, but we have found it also quite useful for the purpose of eye tracking and transparency assessment. So I'll first start the presentation with the blood flow imaging part. So we just need to use the same instrument as usual, set the eye of the subject a little bit backward to increase the size of the field of view, and conjunctival vessels can be directly revealed actually quite easily. And we can measure the variations of blood flow the same way we do it in the retina, and we have a quality of blood flow measurement that is sufficient to assess, for example, the vascular resistance through the resistivity index. And I guess the most notable difference that we have observed between conjunctival vessels and retinal vessels is that we didn't find much signals at very high frequencies as we can do in the retina, where we usually see signal up to 50 or 60 kilohertz. And here in the conjunctiva, we didn't see much signal, usually above 10 kilohertz, which means that the velocity seems to be much slower. So this has two implications in terms of imaging, this lower frequency range. In these two videos, we were either asking the subject to change his direction of fixation or actually moving the head holder so that we would show different part of the eye to the instrument. So therefore the focus is not always exactly the correct one, or there can be some flashes when we are moving the eye. And the fact that we are using lower frequencies, it means that we are also more susceptible to the global motion of the eye, because the response range of the vessels then overlap more with those of the bulk motion. And then because we are using a very large field of view, the SVT is not fully able to suppress the global contribution of the eye motion, because the spatial coherence of that contribution is then sort of destroyed. But despite that, we are able to, see the pulsatility in some vessels and not, and we can already see some nice videos. We have applied the contrast that we had found useful in the retina and choroid for this blood flow movie. So on the left you can see the standard power Doppler images here. It was for 0.5 to 8 kilohertz, and vessels are not discriminated. And then in the middle we use the fusion of images that are taken between systole and diastole, so they reveal the variations of blood flow and how they differ in different vessels. And we can see that there is a differentiation of vessels that is probably due to arteries and veins. And on the right, we did the fusion of these slow and fast flow color composite images. So the slow flow is in cyan and the fast flow is in red. And you can then again see a differentiations of vessels. So in the choroid, such contrast was revealing differently the arteries and the veins, because the arteries were carrying a much faster flow than the vein. And here it's, I guess, probably the case also. So this contrast could be useful to better understand and characterize the conjunctiva, because it's a little bit of a mess as a vasculature. Right, so the second part of the presentation is the eye tracking. So we are doing digital holography, so it means that we can propagate the optical field that we record on the camera to the plane of interest that we want. And because we are illuminating the eye over a very large field of view, we illuminate both the pupil and the retina. We collect light from both of these planes, and we can choose to reconstruct our interferograms on either of these planes. And that's what we do here in the movie. We are changing dynamically over time, switching from the pupil and the retina, and even at the beginning we started the camera. And here you see pictures in the pupil and in the retina, and then on the right this is sort of equivalent B-scan. So on the top it's closer to the camera, then we can see the pupil plane that we can easily identify in practice, because that's where the contour of the pupil is the sharpest. In the retina, this very bright signal that we see is actually the blood vessel. So there is not a good axial sectioning at all, so I don't know if these images are useful, but what's interesting with this technique is that we have a good temporal resolution. And this can be useful for tracking. So we use the same data set that we obtained from an eye that was affected by strabismus, and the retina. When we're doing our blood flow movie, we can be able to assess the variations of blood flow in an artery, and we can also monitor the lateral displacement of the eye fundus through the registration of the blood flow movie. We can do the same in the pupil, measure the lateral displacement and the pupil diameter, and found some very uncorrelated signals for these 4 different parameters over time. The resolution is about below 1 millisecond here for both the retina and pupil, because we are using, whether it's in the retina or in the pupil, the same signal is the defocused light from the retina that we use in the pupil plane, so we have the same temporal resolution. And in terms of spatial resolution, it could be roughly estimated here to about 5 micron in the retina and 10 micron in the pupil. Another interesting thing is that this eye was doing microsaccades every second or so. This has the red dots, the discontinuations of retinal position, and you can see that despite this microsaccade, we are able to monitor blood flow throughout cardiac cycle without being impeded by that, which means that the monitoring of retinal blood flow is very robust against the microsaccade. Actually, that is thanks to the singular value decomposition filtering. Right, so here is the blood flow movies corresponding to these measurements. On the left, reconstructed in the retina, where you can see the retinal blood flow, and on the right you can see the defocused light from the retina in the pupil plane, so that you can see the sharp contour of the pupil that obstruct the light. Here the blood flow movies are reconstructed with a larger short-term window size than the one we use for the registration, because otherwise it wouldn't be very pretty for the movie, but we can use a much shorter short-term window for the registration. And my transition to what comes next is that if you pay attention very carefully to the blood flow movie on the right, you can see that there's a sort of black dust that moves around with the eye, and this sort of black spot, it looks typically as the dust that we would observe on an optical lens, but because it's moving with the eye, we can know that it's actually not dust on the optical system. Unfortunately, it's something that was located on the eye of the subject. So the last part is the assessment of the transparency of the eye. When we are doing reconstruction in the pupil plane and we are looking in the pupil area, the light that we have is actually the Doppler shifted light from the retina, because we use our short-term Fourier transform short-term window, so that we are using blood flow signal in the pupil. The only source of blood flow signal is the light that comes back from the retina. So what we are doing here is actually imaging in transmission the pupils thanks to the light that comes back from the retina. And because we are using a setup where we have polarizing beam splitter cube, and we are doing this blood flow analysis through the Fourier transform and the SVD filtering, then we have images that can be entirely free of specular reflection. And we can use that to reveal the opacities in the anterior segment, whether they are in the cornea or in the lens. So we had these different subjects with opacities that we image with slit lamp and with LDH. And we use actually for each of these measurements the same raw data with LDH to propagate it in the pupil plane, which is the middle row, and in the retinal plane, which is the bottom row. So the first example was anterior polar cataract. You can see that the cataract is visible with a bright contrast with the slit lamp because it's reflecting the light, but with LDH it's actually visible with a dark contrast because it's absorbing the light that comes back from the retina. Then we have examples of posterior subcapsular cataract where we can see similar contrast. We're able to reveal some very tiny absorbing features, and we are able to do so over the entire pupil without having specular reflection, which is the advantage compared to slit lamp. So a single image is able to document all of the absorption that there can be on the pupil area. And the last one is an example of riders, so opacities on the border of the pupil area. So we were curious to understand the effect that cataract can have on the quality of LDH images in the fundus. So we had this subject that we imaged in the fundus before and after its cataract surgery. And we found that actually the cataract didn't have much impact on the quality of LDH images in the fundus. There is at least two reasons that we can think of for that. The first one is obviously that we're not imaging small features, which they would be the first one to be affected by cataract. And the second one is that we are using the whole pupil both for the illumination and collection of light from the eye. So if there is something obstructing the light in the center of the pupil, then it's not so dramatic because we're still benefiting from the rest of the pupil area. Right, and finally, here are some examples of corneal scarring and neovascularization that then again we image with slit lamp and LDH at different frequency ranges. The first one had an implant, that's why it's looking a little bit weird. Then the second and third one, you can see that the scarring is obstructing a part of the pupil, and that is very well revealed by LDH because the diffusion also creates a loss of contrast. And the fourth one, the corneal neovascularization has even invaded the pupil area and the patient had lost her sight. I think the fifth one was a case of iris inflammation, and the sixth one was a neovascularization that we did not really understand because the neovessels were not visible at all with the slit lamp. They were revealed by LDH, but they were really revealed with a dark contrast, which is extremely unusual. It's dark, which means that it's either completely undersampled or oversampled temporally. It's probably that the blood flow is way too slow, but considering that we used a frequency threshold of 1 kHz, it means that either blood flow was stopped, not flowing, or very, very slow. Right. Here are some blood flow movies corresponding to this measurement. You can see that there was a lot of fluctuation of signal in the iris that we don't really know why. There might be some vibration in this part of the eye that creates this bright contrast, and this can create some fluctuations of signal that make it a little bit more challenging to monitor the variations of blood flow in the iris. And finally, this is an example of real-time LDH. Because as I mentioned at the beginning of the presentation, we don't need very high frequencies to reveal blood flow in the conjunctiva, because the blood flow is flowing at slower velocities than in the retina. So we can use just a slower frequency. So here it was just a few kilohertz, and it was enough to see the vessels in the iris and the vessels in the conjunctiva. We were asking the subject to look left and right to show us his conjunctiva on the left and right part of the iris, and we were also switching on and off the light in order to see the iris vessels differently. And so yeah, this can be obtained in real time with a streaming camera and well, a computer that is able to handle real-time computation of a singular value decomposition, but otherwise it's already achievable in real time. So to summarize, what we have shown here is that when we have these raw interferograms that we record on our camera, we can just process them differently than usual in order to be able to, well, monitor blood flow in the conjunctiva, in the iris, in cases of corneal neovascularization. We can use our usual retinal blood flow measurement and track the eye movement with high resolution and assess also the opacity, so that just require different data processing that we use usually. And well, we don't know what is the clinical value for all this work yet, maybe not so high, but what we are very happy with already is that we have shown that we are able to image blood flow in the eye fundus even in presence of opacities and eye movements, and that is something that is quite critical to go towards more clinical application of LDH, because it means that we can make this standard blood flow measurement in the fundus and pathological conditions more comfortably than we expected, actually. Right. Thank you for your attention.